Hello, and welcome to this video on music therapy and Parkinson's disease, and how music therapy can be used as an aid for patients with Parkinson's disease. In this video, we will be discussing what Parkinson's disease is, what music therapy is, what music therapists are, music therapy as a treatment for Parkinson's, and finally, future directions of music therapy. This is Paul. Paul is an 82-year-old male that has recently been diagnosed with Parkinson's disease. Parkinson's disease is a neurological disorder that causes involuntary and uncontrollable movements. Men are twice as at risk of developing Parkinson's disease than women, and one of the biggest risk factors is increasing age. His disorder is caused by a loss of neurotransmitters in the brain, one of them being dopamine, which affects movement, motivation, perception, and allows a person to experience pleasure. It is also caused by a loss of norepinephrine, which plays a role in stress responses, regulation of sleep, and alertness. Paul is currently experiencing symptoms such as tremors in his hands and legs, as well as coordination, motor, and balance issues. Though people with Parkinson's can experience a variety of symptoms, such as difficulty swallowing, chewing, or speaking, as well as changes in cognitive or motor function in simple things like walking or standing. Paul has consulted with a healthcare professional about his diagnosis and the symptoms he is feeling, and he has been referred to a music therapist to help him with his symptoms so they do not progress any further. Paul agrees to see a music therapist but is confused as to what a music therapist is and what music therapy can do for him. The music therapist then begins to explain that music therapy is the evidence-based use of music interventions to be able to accomplish the goals of the individual within a therapeutic relationship by a professional and accredited music therapist. She then explains to Paul that music therapists, and through the completion of their sessions, they can help manage pain, improve communication through singing or humming, promote physical rehabilitation through clapping, walking, or dancing during sessions, can reduce stress, and increase motor skills. She explains that Paul can expect to sing, dance, or improvise by playing his own music or by playing his favorite songs, or even write his own music. Paul has become a little bit nervous as he doesn't know if the music therapist can help him. He's not convinced that music therapists can cater to people with disorders like his. The music therapist explains that she caters to people of all types, regardless of age, musical background, or diagnosis. They cater to people with acquired brain injuries, autism, developmental disabilities, emotional trauma, people in geriatric care, people with hearing and visual impairments, mental illnesses, children in neonatal care, people in palliative care, personal growth reasons, substance abuse, and many more. He agrees to continue his session with the music therapist, and during his session, Paul explains his goals to the music therapist, and she begins by playing some music that aligns with his likes and interests, and music that may help evoke some thoughts or memories. Paul continued to see the music therapist for around 12 weeks. Each session was a little bit different, aligning with Paul's goals and wishes. In each session, Paul listened to music that his therapist played for him. He was able to write some of his own music with the help of the therapist. He sang, clapped, hummed, and danced to the music his therapist provided. After the 12 weeks, Paul saw a reduction in the tremors that he was experiencing in his hands and legs, and found that he was overall happier and that his emotional well-being had improved. He also noticed that after the 12 weeks, and using the singing and dancing technique at different tempos, he had an improvement in his posture, standing, walking, and increased stride length, as well as an improvement in his motor performance and coordination. After seeing such an improvement in his symptoms, Paul would definitely say that music therapy helped him slow the progression of his symptoms caused by Parkinson's disease. Paul hopes that there are some next steps for music therapy, hopefully to be able to expand their application to even more disorders and concerns such as eating or personality disorders or in other forms of rehab. Thanks for listening to Paul's journey on how music therapy allowed him to regain some of his motor control, as well as improved his emotional well-being. We hope you learned how music therapy can benefit patients with neurological disorders such as Parkinson's disease. See you next time.